Hello, I'm Rear Admiral Paul Reed, Director of the Office of Disease Prevention and Health Promotion. Thank you for joining me for another segment of our video series that complements our monthly Health and Wellbeing Matter blog, where we meet with partners from across the public and private sectors to discuss work helping to advance health and well-being for all people. In September, we observe National Healthy Aging Month, a time when we celebrate the positive aspects of growing older and increase national attention on the health and well-being of older adults. Although it may feel like it at times, aging isn't something that suddenly happens or is defined by a particular stage that we reach in life. It takes place over the course of our lifespans, which is why at ODPHP you'll find concepts of healthy aging integrated into all the work that we do, an approach that embodies the idea that healthy living is healthy aging. My office recently released the Physical Activity Guidelines Mid-Course Report, which highlights strategies to increase physical activity among older adults. Additionally, older adults have always been a priority audience for our Move Your Way campaign. Our Healthy People 2030 initiative has measurable objectives specifically focused on reducing health problems and improving quality of life among older adults. And the most recent edition of the Dietary Guidelines for Americans includes recommendations across the lifespan, including specific guidance for older adults. Today, in light of the shift in the median age of the population, promoting health and well-being among older adults is more important than ever. And with that, as a backdrop for our conversation, today I'd like to welcome Ms. Patricia D'Antonio, Executive Director of the National Center to Reframe Aging and Vice President of Policy and Professional Affairs for the Gerontological Society of America, to talk about the importance of highlighting the contributions of older adults to society and to address some of the misconceptions we collectively have about aging. Trish, thank you very much for joining us today.
Thank you so much for inviting me. It's a pleasure to be here.
Let's begin with the broader picture. Research suggests that the public's perception of both the aging process and the expectations of older Americans are generally negative. And yet, this contradicts how most older Americans actually feel about themselves. And despite the health considerations that come with aging, the reality for many older Americans is very different than this negative perception that many other Americans may have. So I was wondering if you could provide us with a better perspective on what aging actually means, and both as a process and in very practical terms.
Well, it's a good question and a good lead into this question. I think, first of all, when we think about what aging really means from a process perspective, we think about how our bodies change functionally and physically over a time course, right? So over our life course. So that's the easy thing to think about, right? I mean, everybody kind of gets that concept.
You can't help but think of it.
Right. I mean, so the thing is that we are all aging, right? We're aging from birth on. When we think about it from a practical perspective, I think a couple things come to mind. One, in the last century, we are certainly living longer and healthier lives. Right, if we think about the turn of the century in the 1900s to the 2000s. And what that means for us as far as a culture, a community, how we can contribute so much more in society as we age, thinking about social contributions, thinking about civic contributions, thinking about economic contributions even. But as you point out, unfortunately, we are bombarded with messages that give us a negative perception, or maybe not always negative, but just a singular perception of what it means to grow old. And I think that, we see that from a very young age. So we see that on television, we hear that in jokes that people tell. So we really hear it in our culture, images that are portrayed. And so by thinking about that and how that informs our thinking and the split-second decisions we make when we hear people talk about aging or older people, it really does impact us. But what we really recognize, and what the good thing is about what we're working to accomplish through the National Center to Reframe Aging, is that we live longer, healthier lives, and that contributes, we are able to contribute wisdom and momentum, right? So we have accumulated wisdom that we can continue to share in our communities.
Thanks. That's perfect.
Thank you.
So how do we better communicate this perspective that you just shared? And what does it take to truly reframe aging for the American public? And to realize, frankly, the vision that your organization espouses?
So the National Center to Reframe Aging, our goal, our mission is to end ageism, counter ageism, and how the public perceives aging. And we are led by the Gerontological Society on behalf of 10 national aging organizations. So this is a true concerted effort by 10 leading aging organizations, along with some really thoughtful philanthropy, both nationally and locally. So this effort goes on throughout the country in a way deep rooted in our communities, as well as the national efforts that we're taking. What we did was we worked with our research partner, the Frameworks Institute, and we went out to find out, well, how do experts perceive aging? What do experts think about aging? And what do members of the public think about aging? And that really helped us to see the work that we know that we need to accomplish, how we can help people develop communication strategies about aging so that we can change the perception of aging.
Right.
You know, and so that's really been the work that we've been addressing for about the last 10 years, starting with our research and then moving on with how do we get people to understand what that research tells us and how we can apply that work.
You mentioned the term ageism, and it's something that we hear not infrequently these days. I was wondering maybe if you could share your definition of the term.
Sure. So when we talk about ageism and the direction of our project, right, this is any kind of a discrimination toward older people. Okay? And what we do recognize about ageism is that ageism can occur across the life course. So while our project is focused on older people, certainly we hear ageism across the life course. People will make comments about somebody being too young to be part of something. Right? You know, she's too young to run that department, she's 24. You know, as if your chronological age has something to do with that. And I think when we think about definitions of ageism, then it goes a little bit more deeply to think about not only the external ageism that we may all experience, that ageism that you hear from someone else, but we have our own internalized ageism.
Sure.
And that's...
it's a constant battle, isn't it?
It is a constant battle, and it's something that really has health implications for us all. One thing I think we should all recognize, and this impacts us from a perspective of healthy aging, Becca Levy and her colleagues at Yale University have published some research and done some work that talks about how that our positive perceptions of aging, our internal positive perceptions of aging, can increase our lifespan by more than 7.5 years. Right. And when you think about just our perception, what we think about aging, how that can impact us, it's so important. It's just as important that, you know, when we feel pain and we say, oh, that's just because I'm getting older, and we don't go seek a healthcare practitioner's help, professional help, it's just as important that we seek that help and not just attribute that to a chronological number, right? How many birthday candles were on our cake last year, as well as just that positive perception. I find that research so fascinating.
That's going to be my biggest takeaway from this conversation I have a feeling today. So tell me, why is reframing the concept of aging important to the health and well-being of older adults? And what does this mean in terms of community and health equity?
So that's a really great question. And in addition to the work that Dr. Levy and her colleagues have done, I think really when we think about that internalized ageism, that can impact our health and well-being. And that can impact our health and well-being. It doesn't start at a certain age, right? That impacts our health and well-being across the life course, and why I think it's so important, the work that you and your team do in incorporating that concept of healthy aging across the life course. right? I mean, it doesn't start at 60 or 65. It starts when we're born, right? And the other thing in our communities, the opportunity for us to recognize that there are probably 4 or 5 generations, maybe even 6 generations in some living together in a community. So the importance of how we communicate and how we understand older people, how we understand our intergenerational impact, right? So when we get that opportunity to be together in a multi-generational family or in community, it really does impact how we think about and how we recognize the importance of all generations, right? And recognize all our contributions for a collective benefit in our community. I know some communities around the country now are working very intentionally to bring older people into high schools, to have high school and middle school age students working with older people to get to know and not have, not only think in that one-dimensional way about aging, right? And to recognize that we're all so much different, so much more different as we age. We talk about heterogeneity, that's the big word, but really it's our diversity as we age.
Sure. I really appreciate that, you know, that we tend to segregate ourselves by age artificially, oftentimes. So taking a deliberate act to bring those age groups together, I think, is powerful.
It is.
Okay. Well, it's clear that our words and our the way in which we choose to think about older adults and to refer to them in the process of aging is a very important aspect of all of this. So I wonder what strategies you all have come up with for professionals and others to better frame their perspectives and the way they communicate around older adults and the aspects of aging.
Sure. I think the first thing that's really important to know is that we did research this work. So we do have evidence to show that applying some of these strategies really can get at people's biases toward aging, right? And so what's really important here is, well, first of all, you have to practice it. It doesn't come natural all the time, and it's okay. Because we recognize this will take about a generation for us to really make the change that we seek. But some of the things that we could start with societally as a whole, you know, I mean, we know that there are individual pockets around the country where there's probably more advancement than others, and that's okay. That happens, and that's how we see change. But when we talk about some of the strategies we can start to employ, one thing that we often hear is an us versus them, like always using the word they when we talk about older people.
As if they're not part of us.
Right. And when we talk about the aging population, well, we're all members of the aging population, right? So because we're all aging, we hope.
There's another key takeaway for today.
And so even a person that might be of an age group that we're thinking about, like if we're talking about people aged 65 to 75, being really specific about that instead of just saying older people, so that whomever you're communicating to can have a better idea and a better picture in their minds about aging. But the us versus them is really a place where I tell people to start first. And usually if I'm writing something, if I'm a healthcare practitioner and I have to, and I'm writing an education piece, or if you're working on a website, a web page, right? Write what you have to write, and then go through and see how many times you refer to older people as they, when they age, when they, and really think about how we can make it about all of us, so as we age. Another place where we see opportunity for language change, and I have to admit that I've used this term, not recently, but when we talk about the silver tsunami, so that fatalistic thinking, that crisis thinking.
Negativistic.
Well, it's very negative. And what would you do if somebody was telling you there was a tsunami coming? You run. So really thinking about how we phrase and recognize we're all members of our community is so important and so valuable there. And it can even be as subtle as when we start talking about statistics about older people, right? Or start talking about statistics about any age group. If we really front load any discussion with the statistics, people start to say, well, that's a little bit too much for me to handle. And really, you could start to talk about your solution first, your systemic solution, and maybe the statistics come in the second paragraph.
Okay.
You know, so
Great.
that's another way. The last way that I think would be really good for listeners to think about, and we do have resources to help support you in this journey, is when we talk about what we call a super senior, right? So that person, you know, that person who's 80 years old and just ran a marathon, which is fantastic. What's the context that helps supports that person?
Right.
Right? So there's transportation. There are sidewalks, so they run every day on a sidewalk. There are just other services in the community, other supports in the community that help that person continue to be able to run the marathon, jump out of the airplane.
It's not just the individual, it's
right.
the social circumstances as well. Right?
That's exactly it. And and that's part of what we start, when we start talking to people about how they can make the change, those are 3 places where we really say you can make a significant change with just tweaking a little bit of what you say or what you write.
Terrific. Those are very practical and anybody can pick them up and run with them. Yeah.
Exactly.
Excellent. Well, thank you very much for this. I really appreciate the conversation. It's been tremendous. I'm sure our listeners are going to take away a lot. I know I have a couple of pearls that I'm going to live with just from having heard you speak today. So thank you.
Oh, I'm so glad. Thank you so much. And I would just say we do have tools and resources to support people as they start to think about what they can do to change their communication strategies. So we would be happy to work with anybody.
Great. And to that point, to learn more about ODPHP's Healthy Aging Initiative, please visit health.gov. And to learn more about the National Center to Reframe Aging, visit reframingaging.org. Thanks.
Thank you.
Produced by the U.S. Department of Health and Human Services.